Antimicrobial therapy can be understood by considering spectrum, principles of action, and drug combinations. First, spectrum. Narrow-spectrum drugs are effective only against certain groups of microorganisms. Broad-spectrum drugs act against both gram-positive and gram-negative organisms, making them more versatile but also more disruptive to normal flora. Next, the principles of antimicrobial action. Selective toxicity refers to the ability of the drug to act on the microorganism without damaging the host's cells. Bactericidal drugs kill bacteria outright and do not require the host's immune defenses to clear the infection. In contrast, bacteriostatic drugs only inhibit bacterial growth reversibly, and the ultimate destruction of the microorganism depends on the host's immune response. Finally, drug combinations. Sometimes, combining drugs can enhance or diminish effectiveness. Synergism occurs when the combined effect of two drugs is greater than the sum of their individual effects. In other words, 1 + 2 = 4. Antagonism, however, happens when one drug decreases the activity of the other. Here, 1 + 2 results in only 1. Let's review the main classes of antibiotics, their actions, and key clinical notes. Beta-lactams include penicillins, cephalosporins, carbapenems, such as imipenem, monobactams, such as aztreonam, and beta-lactamase inhibitor combinations like augmentin. They act by inhibiting cell wall synthesis. Drugs such as ceftriaxone and cefotaxime are widely used, making this class a cornerstone of therapy for both gram-positive and gram-negative infections. Glycopeptides, represented by vancomycin, also inhibit cell wall synthesis. Vancomycin is the drug of choice for serious infections caused by Clostridium difficile and methicillin-resistant Staphylococcus aureus, or MRSA. Aminoglycosides include gentamicin, tobramycin, and amikacin. These act on the 30S ribosomal subunit to inhibit protein synthesis. They are not effective against anaerobes, but can be combined with penicillin to treat enterococcus infections. Tetracyclines, such as tetracycline and doxycycline, also act on the 30S subunit. They interfere with protein synthesis but have important side effects, including effects on bone and teeth in children, and they may lead to yeast superinfections. Lincosamides, represented by clindamycin, inhibit protein synthesis. They are particularly effective against gram-positive and gram-negative anaerobes. Chloramphenicol acts on the 50S ribosomal subunit to inhibit protein synthesis. While effective, it is rarely used today because it may cause aplastic anemia, a serious adverse effect. Macrolides, such as erythromycin, also act on the 50S subunit to block protein synthesis. They are widely used for respiratory and soft tissue infections. Fluoroquinolones, such as ciprofloxacin and norfloxacin, inhibit nucleic acid synthesis. They are especially useful for Pseudomonas aeruginosa and other aerobic pathogens. Rifamycins, represented by rifampin, also inhibit nucleic acid synthesis. They are used for gram-positive and some gram-negative organisms, including Neisseria meningitidis and mycobacteria. Sulfa drugs, such as sulfamethoxazole, act as analogs of para-aminobenzoic acid, or PABA, interfering with folic acid synthesis. They are used for urinary tract and enteric infections, and are often combined with trimethoprim, as in Bactrim. Streptogramins, such as quinupristin and dalfapristin, inhibit protein synthesis. They are important for treating gram-positive organisms, particularly vancomycin-resistant Enterococcus. Finally, oxazolidinones, represented by linezolid, also inhibit protein synthesis. Linezolid is effective against gram-positive organisms, including those resistant to multiple other antibiotics. Susceptibility testing helps determine how well bacteria respond to antimicrobial agents. The Kirby-Bauer method uses disc diffusion on Mueller-Hinton agar. The agar must have a depth of 4 millimeters with a pH between 7.2 and 7.4. Physiologic concentrations of calcium and magnesium are required. Plates are incubated at 35 degrees Celsius in ambient air. The inoculum should contain about 10 to the 8th organisms, matching a McFarland 0.5 standard. Quality control is performed weekly and with each new lot of agar or discs using Escherichia coli, Staphylococcus aureus, and Pseudomonas aeruginosa. Broth methods determine MIC, the minimum inhibitory concentration, which is the lowest drug concentration that prevents visible growth. They also measure MBC, the minimum bactericidal concentration, which is the lowest concentration that kills more than 99% of organisms. MBC is determined by subculturing tubes near the MIC and identifying the first plate with no growth. The E-test uses plastic strips impregnated with antimicrobials, providing an MIC directly on the strip, often referred to as MIC on a stick. Modified methods are used for slow-growing or fastidious bacteria. Examples include Haemophilus test medium, supplemented Mueller-Hinton for Streptococcus pneumonia, and supplemented GC agar base for Neisseria gonorrhoeae. Extended-spectrum beta-lactamases, or ESBL, are enzymes that confer resistance to third-generation cephalosporins and monobactams, but not rifamycins. When ESBL are detected, all penicillins, cephalosporins, and aztreonum should be reported as resistant. Escherichia coli and Klebsiella species are frequent producers of ESBL. The Nitrocefin disc test uses a chromogenic cephalosporin. Nitrocefin changes color from yellow to red when the beta-lactam ring is hydrolyzed. This detects resistance in Haemophilus, Neisseria gonorrhoeae, Moraxella catarrhalis, and anaerobic gram-negative rods. It does not detect ESBL activity in enteric gram-negative rods. The D-test detects inducible clindamycin resistance. It uses a clindamycin disc and an erythromycin disc placed close together. Resistant strains show a characteristic D-shaped zone of inhibition. Detection of MRSA involves observing a zone of 10 millimeters or less with an oxacillin disc on Mueller-Hinton agar, and can also be confirmed with molecular testing for the MECA gene. Vancomycin-resistant enterococci, or VRE, represent another important resistance phenotype. Carbapenem-resistant Enterobacteriaceae, or CRE, produce enzymes that inactivate carbapenems. Common organisms include Klebsiella pneumonia, Escherichia coli, and Enterobacter species. They are resistant to penicillins, cephalosporins, carbapenems, and aztreonum. Detection methods include the Modified Hodge test and chromogenic media. Finally, automated susceptibility testing systems streamline AST in clinical laboratories. Examples include BD Phoenix, Microscan Walkaway, and TREK Sensititro. When performing disc diffusion susceptibility testing, several errors can affect the results. First, let's consider pH errors. If the agar pH is too low, tetracycline and clindamycin zones will appear larger than expected with E. coli or S. aureus controls. If the agar pH is too high, those same antibiotic zones will appear too small. Next are ionic content errors. If calcium and magnesium levels in the agar are too high, aminoglycoside zones appear too small with Pseudomonas aeruginosa. If calcium and magnesium are too low, those same zones will appear too large. We then move to inoculum and depth issues. If zones are universally too large on control plates, this can be due to a light inoculum, a nutrient-poor medium, slow-growing organisms, or agar that is poured too thin. Conversely, if zones are universally too small, the inoculum may be too heavy or the agar depth too thick. Now methicillin and oxazolidine problems. If methicillin control zones decrease over several days, the antibiotic may be degrading during storage. If methicillin zones are indeterminate in the DIS test, it may be because methicillin is being degraded by staphylococcal beta-lactamase. Finally, there are other sources of error. Colonies growing within a zone of inhibition may indicate a mixed culture or resistant mutants. A special finding, called the zone-within-a-zone phenomenon, can occur with Proteus species swarming, producing double zones of inhibition. It can also occur when beta-lactamase-producing organisms are exposed to penicillin or ampicillin, causing irregular inhibition zones.